And that's something you'll run into because you'll get these jobs in clinical, the therapists, the medical team, they'll rely on you to address these issues. And if you don't have any experience addressing these issues, you'll get eaten up and spit out. The last thing they're going to want, and they'll terminate you for this, is if patients are trying to AMA and you're just like, okay, whatever, I don't, like they don't want that. They want a provider that's going to try to like keep the patients there, like motivate them, talk to them, like, why should you stay in treatment, right? They want those kind of things. One of our KPIs that we have at treatment centers is providers AMA rate. So if you're in, let's just say, the silver group at a treatment center and you have 15 patients and your AMA rate is above 10%, which means like a patient that wants to leave and they leave, a lot of times, you may not have a job for a long time. And sometimes it's not, sometimes you do everything you can do and the patient's still going to leave, but it's important to know these things. So just having some knowledge on how to do that is important. That's why I'm sharing this with you. Important things, again, get family involvement, find out what the repercussions are if they don't complete treatment. And another thing, be on the lookout for, because a lot of providers make this mistake, is filling out FMLA paperwork when they come into treatment, and then they AMA 2 days later, and then you get a call from the insurance company 3 months later saying, hey, what's going on with this patient? And you're like, oh crap, like, because usually treatment, you'll write them out for 90 days for FMLA.